Tonight, Local 2 investigates a call for help from those working in our mental health care system. Those struggling to provide mental health care look to state legislatures for more funding. But KPRC Local 2 investigative reporter Robert Arnold sat down with a Houston lawmaker who says it's going to take more than money to fix our area's problems.
I don't think there's a lot of question about what we need.
Dr. John Zerwas is both a state legislator and chief medical officer for Memorial Hermann. He sits on the House Appropriations Committee and says the debate is not about what services are needed for the mentally ill, rather
the infrastructure and the ability for people to tap into readily available mental health services doesn't exist within the city of Houston, Harris County, or even the surrounding region.
State budget cuts caused a lack of hospital bed space and scarce funds for long-term outpatient care. What this has created is a crisis-driven system. Many of those with mental illness cycle in and out of acute care hospitals and ERs, or don't get help until they're arrested and thrown in jail.
Is it the most reasonable, cost-effective way to deliver health care services? Absolutely not.
But Zerwas argues simply throwing more money into mental health care won't solve all the problems. He says there first has to be an overarching plan.
Houston, in particular, has not really developed the network of primary care clinics and access to certain types of health care that other cities across the nation have.
Well, those Local 2 investigates spoke with agree with that statement.
There really is no comprehensive plan for mental health services in Harris County.
They also argue part of the problem is they believe Texas doesn't put mental illness on the same level as medical illness.
We've seen the same phenomena with cancer, with coronary disease. People don't have access to primary care and preventative care, then it becomes chronic. And it's no different with behavioral health.
Even though Health and Human Services spending accounts for 40% of Texas's budget, mental illness is rarely at the forefront.
I don't know, again, that there's really been a spotlight on it that would help us say this needs to rise to the top of the priorities for the state of Texas.
Those in the mental health care industry say in the end, it's all about choosing where to spend the money.
We have to decide, are we going to spend it in the jailhouse, treating patients with psychiatric illness over there, or are we going to take it to medical homes, provide appointments, provide therapy and psychiatry in the medical setting?
Last session, legislators did commit an extra $82 million for mental health care in Texas. Those we spoke with say it's a great start, but when you spread $82 million throughout the state, they say it doesn't go far enough. Robert Arnold, KPRC Local 2.
And studies have shown that treating mental illness on an ongoing basis has high success rates. Schizophrenia, 60% success, depression, 40%, and bipolar disorder, 80%. Now, if you've got a story for Local 2 Investigates, you may want to give the tip line a call at 713-223-TIPS, or feel free to email Local 2 Investigates at click2houston.com.